Your teenage child has been diagnosed with functional neurological disorder, short for FND, and your doctor tells you to find an FND specialist. If you're lucky, you might be getting a referral for this FND provider, but since FND is so new to you, you don't know who these people are, what is a good option for your child, or even the right one for your child. I'm going to tell you what to look for and what not to look for. Let's do this. Hi, I'm Dr. Lee. I'm a pediatric health psychologist and teen FND specialist. I've got tons of resources for you right off the bat, so check the link below in the description box for any resources that you're looking for, and then more to come. So today's video is really about what kind of providers or specialists to avoid and what to do instead. I have 3 different categories, so let's go one by one. So I have been working with teens who have struggling with FND for quite some time and have met and worked with hundreds of families. And I am starting to notice that number one, the good thing is that even though this is heavily commonly occurring things, which is FND, yet nobody knows about it. However, I am starting to notice that there are some patterns as to who gets better and who doesn't get better. Now, there are so many patterns here. However, I'm going to focus really on what kind of providers or treatment or approaches you want to take versus not to take. Once again, let's talk about what is FND. It is an umbrella term to describe this brain and body communication problems, even though your child's brain and body physiologically and structurally are looking quote unquote a-okay. It is a real diagnosis and your child is not making things up. Again, very common diagnosis you would get in neurology clinic, even though you have never heard of it and you don't really know anybody else who has this same condition. No, it is not just one thing that is causing the FND. It is a complex biological, emotional, and social phenomenon. I have tons of videos talking about what biopsychosocial phenomenon is, but for now, adult and teen FND are also different, which I'm going to talk more about it. So let's get to it. Number one, so these are the providers that you should definitely avoid based on my experience. FND provider who is not specialized in children or adolescents. In other words, these are the FND providers who are mainly working with adults, but claiming that they can also work with kids and teens. I would say those are red flags. I mean, a little bit pet peeve here because I'm a pediatric health psychologist and I've got tons and tons of training specifically working with children and adolescents and their parents. I have worked with adults as well because I've got like a 25 years of mental health experience. However, working with kids and their parents are totally different ball games than working with adults. Look, kids are not the small adult. And it sounds so, I don't know, like very basic, but a lot of providers are pretending that kids are the same thing as adults. So they have the exact same treatment approach between adults and kids. And I would say, in my mind, that's a red flag. As I mentioned, teen FND is not the same thing as adult FND, and then here's why. With adult FND, most of them are related to some sort of childhood trauma or adverse event, all right? And adults are naturally more independent. They might have a spouse or other family members, but for the most part, they're pretty independent. Not so much with the FND, however, adult as a general sense and term, they're more independent. Whereas teens, with the trauma thing, it's less than 50% of the case. So if any provider that you're working with or about to be working with is insisting that your child must be having some sort of trauma or what kind of trauma did your child have and all of that like right up in your face, then that is a huge red flag for me because that is not necessarily the case with every single teen. Yes, there is a case, but the cases are much less happening for teen FND compared to adult FND. And as I mentioned, if you're working with kids, inevitably, I'm assuming you are a parent of the teen FND because most of the viewers on my channel are parents. So here's the deal. Whenever you're working with kids, you have to also work with the parents. With adults, Do you always have to work with the adult's parents? Not necessarily. Once again, I'm not saying absolutely not, but chances are much, much lower compared to working with kids, almost always working with parents. Again, that is the difference between pediatric provider and adult provider. So if you are a parent of a teen or children, then I would definitely look for a pediatric FND specialist. Number two, this sounds really silly, but any provider who is not specialized in FND. Now, why do I say that? Because oddly, but enough times, a lot of doctors who give a diagnosis of FND, they will say to you and your child, highly likely, go see a mental health professional. Go see a counselor. This is mental health problem, so you need to see a therapist. Yes, I get it where this is coming from, which I talked about the history of the evolution of FND. Again, FND was used to be considered a pure mental health diagnosis and disorder. That's why a lot of doctors still have that old mindset. FND equals mental health equals go see a mental health professional. Is there anything wrong with seeing a mental health professional? I mean, I am a mental health professional, so there's absolutely nothing wrong with it. However, here's the deal. If your child has a cavity like bad teeth, who do you go to? A dentist, or maybe orthodontist, but anything that has to do with the dental specialist, right? You don't just take your child to a random, vet, or pediatrician over and over and over again when you know what your child has is a cavity. Same thing. If your child has an FND, why do you take your child to non-FND provider? Same thing. To me, it's just a thing. However, likely you are following your doctor's orders. Your doctors are likely telling you to go see a mental health professional or just go see any physical therapist, just go see any occupational therapist, right? Now, chances are you might know really well, yes, you need to go see an FND specialist, but the resources are really lacking. That is definitely the case. So I'm not saying don't see anybody until you see an FND specialist, but these are, based on my experience, unfortunately, something might be better than nothing. However, the recovery speed and the odds of actually recovering is really, really not that great if your child goes see any provider who is not specialized in FND, which translates to your child feeling very frustrated. And so do you, right? So that's the reality of it. And number three, honestly, guys, I made this video just to talk about this point, really. So hear me out. There are unfortunately some FND providers that they're claiming that this is their specialty. However, they are totally coming from this, what I would call it, sick care model. So let me walk you through what exactly I mean by that. And I have to look at the cheat sheet because I need to, talk to you like really correctly, okay? So this is the kind of FND provider who is telling you and your child, FND is a permanent disability and you're going to have this for the rest of your life. So you need to learn how to live with it or how to cope with it. I'm saying if you hear that from this quote unquote FND provider, especially once again, this is specifically for teen FND and then pediatric FND, all right? Adult FND is a little bit different ballgame, but I'm just focusing on teen FND. So if you just happen to be a 20-somewhat adult saying like, been there, done that, and then this is my permanent disability, well, I'm talking to the teens who have FND, all right? So, but anyway, let me go back to this. So if your doctor or provider is saying, yeah, your child FND is permanent, so might as well just live with it. Absolutely not the case. Again, it kind of depends on how long your child has been struggling with FND, what other factors are going, and all of that stuff, which I have tons and tons of videos about who gets better versus who doesn't get better. But this is definitely a red flag for me if I were you, the parent. Number two, if this provider is FND provider who is creating the sick care model is telling you and your child need to keep coming back to see them for the rest of their life. Again, this is permanent. You might get better, but you definitely get worse. And you are just going to continue this better, worse band camp, but never get better. So you are likely to coming back to see me maybe 2, 3, 4 months, a year down the road. Guys, with my experience as a pediatric health psychologist, that is definitely not the case. Many of the patients that I work with in my private practice here, once they get better, they are off. Now, how long does it take for them to get better? Really varies. So it's really hard to say like, oh yeah, you're going to get better in 3 months and then you never have to come back to see me, that kind of thing. And yes, it is true that your recovery is going to be up and down. It's never a linear. Even if you're on the streak of, yay, I've been symptom free for 2 months, and then something happens and then bam, you have the episode, that happens too. That is part of the healing journey. So I'm not talking about that. But providers saying you are likely to continue to come back and that is normal, that is not normal. All right. That is absolutely not normal. So I would say, stay away from that. And then this is my biggest point. Once again, most of the viewers on my channel are dedicated parents. So with love, this is for you guys. If these providers are telling and teaching you as a parent exactly what to do, meaning actively intervening the child to come out of FND episode by you doing something directly to your child, like putting the weighted blanket on or suggesting, oh my gosh, you're about to have an episode, so let's blow bubbles to relax yourself, or start sprinkling water on their face, or putting ice cube on your child's forehead and neck and things like that. So then you as a parent are being taught how to help your child come out of the episode. Huge red flags. I'm going to talk to you about consequences. Number 1, your child does not get better. I'm talking about in a long run. Can your child completely resolve from FND? Again, if you're a pediatric FND case, teen FND, chances are pretty darn good. Unless you as a parent take over the responsibility and do these interventions on behalf of your child, then yes, you are definitely going in that band camp of FND is permanent disability band camp. So that's one consequence. Number 2, you as a parent may feel good about doing something in that moment, like reducing your own anxiety, but you're taking away the responsibility and then the power out of your child. So sort of like a soul sucking, right? Which I believe is the opposite of what you want your child to be having. If you are a caring, loving, dedicated parent, then I would imagine, I'm a parent myself too, you would want your child to be responsible adult, successful adult, and happy, and then doing whatever they want to do once they put their mind. And I believe that is exactly what you want. But look what's happening. If you're catering towards reducing your own anxiety by doing something active, so you're feeling so empowered yourself and then telling yourself, now I know what to do to help my child come out of the episode every single time. The invisible script with that is because my child cannot do it on her own. Therefore, I need to be the one to rescue and help my child all of the time. Which again relates to directly, your child does not get better. Therefore, this permanent FND band camp that you're basically signing up yourself. And with all of these things, what's happening? Because of the sick care model that you keep going back, because when you go there, it's like, oh my gosh, this is the new approach, the new tips and tools that I can use as a parent to help the child. You end up going back there all the time. And look what's happening. You're spending a lot more time, energy, and financial resources to stay on this permanent, eternal sick care model that works in the short term, but does not work in the long run. I talked about financial costs of FND. I mean, it is an upward of $90,000 US dollars per year, every single year. You are spending almost like you can buy a house, or at least a down payment, kind of amount of money on FND every single year. 90,000. It's not 19, it's 90,000 US dollars per year. It's an upwards. So what can you do? And I know I get super fired up about this because I care, and it is so, so sad and disappointing to see these kids getting better, but then they took this wide course of going into this sick care model and thinking blindly, oh my gosh, this is so helpful. In the long run, it's not helpful. So what can you do? What are the things that you need to do instead? Well, number one, you've got to know what FND is. Now, this channel is really about educating your parents and the teens what exactly FND is, so then you are really understanding what it is. Instead of refusing the diagnosis and trying to chase after, there's gotta be something else, a hidden diagnosis. So please, once you get the diagnosis of FND, yes, you can have a doubt, of course, because it's new for you. However, accept the diagnosis, because FND diagnosis also comes with other diagnoses as well. A lot of times, not all the times. For example, your child might be having epilepsy and non-epileptic seizures at the same time. That's like upward of 30% of the kids who have epilepsy also have a non-epileptic seizures. So it doesn't have to be one or the other. But as soon as you get this non-epileptic or FND diagnosis, again, non-epileptic seizure is a type of FND, then you've got to find a pediatric FND specialist. And I have a good trusting source link down below. So check it out and find the providers. These are the ones that I personally vetted, and they are trustworthy. So please check it out. If you think that there is no providers, hold that thought, because there are actually a bit of FND pediatric specialists across the country. And lastly, but really importantly, parents, you need to become aware of your own anxiety and make a decision really about what is important. Is it more important for you to reduce anxiety and the stress level for yourself right in that moment, every single time it happens, so you feel like you are empowered? Or suck it up. This is very uncomfortable, but I am going to help my child no matter what, and punt it back the responsibility to your child, even though it might take a little while, because your child needs to learn how to pick up the baton and run with it. Is your child going to take time, make mistakes, and fall a lot? Absolutely. That is part of the development. So by all means, this way is not a quick fix. That way, you catering to your own anxiety and then stress and reduce those things right away is a quick fix. Absolutely. This way, having your child learn skills and strategies so they can deal with their own body and then be done with FND takes a bit of a time, but you have to make a decision. Which one is more important for you and your child? I cannot answer it for you because you are the one who can tell which one is important. But what I can tell you is, if you stick to this band camp of I cannot tolerate my own anxiety and frustration and helplessness, I cannot tolerate that I cannot do anything for my child to get out of this FND episode, therefore I'm going to keep going to this route, then unfortunately, 100% of the time that you and your child are signing up yourself for this permanent disability band camp. So your choice. Nobody can tell you what to do except you and your child. And I am here to provide very honest and perhaps unpopular opinion, because there are so many FND providers out there. But once again, I truly care for kids getting better. And then when I say kids getting better, is getting their life back and really learning the skills and strategies to manage their own symptoms, because that is a true sign of empowerment and self-awareness. And I have seen these successful cases one too many times, and I hate to see this child getting better but getting sucked right into this permanent sick care model. Now, unless you feel good about this care model, then I don't really have anything more to say, but I really believe that you as a parent have a authority and influence to make the change happen for you and your child. Now, comment below what kind of providers or recommendations did you get? Because I hear these things over and over again and thinking that this sick care model is normal. I will say with teen FND, absolutely not normal. They get better, they are off we go. I have seen that one too many times to even change, and because research 100% of the time and time again says the more child has their own empowerment, control, and their self-awareness, they get better. So they can be done with FND and then get their lives back. You are the key to unlock this castle for your child. But you also have the key to unlock a different castle to be imprisoned for the rest of you and your child's life. So the choice is yours. I know this is very unpopular, again, opinion. However, I think this is really important because I have seen one too many families who continue to struggle. Thank you so much for watching this video, and I will see you in the next video.